Hello everyone, uh, my name is Dr. Sagar Bhargava and I am a cataract, glaucoma and Lasik surgeon. In my years of Lasik practice, I have realized one thing is that most of the patients have a set of common general questions about Lasik. Hence I decided to make a video which will basically answer these 10 most commonly asked questions by the patients so that they go equipped with this knowledge to their doctors, and then the doctors can pass on to the next level of information that may be required for their further planning of their treatment. So let's get started. The first question that is asked is, what is LASIK and how safe and accurate is this technology? Now, LASIK means laser in situ keratomelusis. It essentially means that the laser is used to reshape cornea by removing some amount of corneal tissue. What it induces is it basically changes the shape of the cornea by flattening the cornea. The degree of flattening would depend on how much correction you have to do. Higher the power would mean that higher will be the degree of flattening. It uses a laser called as excimer laser, which has a very short wavelength of 193 nanometers. So LASIK is not a new procedure. Its clinical trial started way back in 1991. It got US FDA approval in 1995. It works on the principle of photoablation, meaning it removes the corneal tissue by breaking the intermolecular bonds and releasing the molecules in such a way that the underlying residual corneal tissue is absolutely clean and smooth. So the tissue removal process is very precise and doesn't cause any abnormality in the underlying surface. So LASIK has been in use for the last almost 25 years, which obviously means that it is safe and it has stood test of time. What makes it safe? The reason for this is the preciseness. That means if you look at the laser beam, each pulse that touches the tissue just removes about 0.25 microns of tissue. 0.25 microns is equal to 1 by 4,000 of a millimeter. So it just removes that much amount of tissue. If I were to give you an example, look at this photograph. What you see here is a human hair which is about 15 microns in thickness. We know how thin it is. So on this human hair you can see those grooves. Now these grooves are possible because of this preciseness and accuracy of the LASIK laser technology. This has obviously been done by a LASIK machine. The next question is, what is the criteria for Lasik eligibility? So the Lasik eligibility requires a good general health of the patient, good eye health, and examination of specific portion of the eye, that is cornea. So all these things are done in a pre-Lasik evaluation. In general, Lasik rejection rates are about 30%. In other words, only 7 out of 10 wanting to do LASIK are deemed fit for the procedure. Let's move on to the next question, and it says, can it fully correct my power? Yes, it can correct your power provided you are in the correctable range of LASIK, which is about -10 diopter for myopia and about +6 diopter for hyperopia. There is another factor into this, which is the patient's corneal thickness. Now each diopter of correction would mean about 14 microns of tissue being removed from the cornea, and we need to leave at least 300 microns of tissue back. We call it as residual corneal bed for the safety of the patient. So these two factors are taken into account, calculations are done, and then we are able to tell you how much would be the level of correction that can be achieved by LASIK. Let's move on to the next question. So the question says that, is LASIK painful? I think one of the most commonly asked questions. The answer is no. Let's just think logically. The age group in which this LASIK is done is between 18 to 45. We all know that in this age group, the sensations are very, very strong, nerve sensations. So the pain threshold also is low. So if it would have been so painful, it would never have become such a popular procedure throughout the world. So, so LASIK is done under topical anesthesia with the help of eye drops, which are put intermittently in patient's eyes, and these are basically numbing drops. What will happen during the procedure is patient will feel that something is happening around his eyes or on his eyes, but patient will not feel any pain or discomfort. So let's move on to the next question. Can LASIK cause blindness during the procedure? Well, the answer is emphatically no. The reason being that it's a very safe procedure, and there are multiple safety mechanisms which are present in the machine. On the top of it, the laser that is used is called as a cold laser, which has got a very limited penetration. So during the procedure, there is absolutely no chance of blindness with LASIK. So let's see the next question now. So what happens if my eye moves during the procedure? Absolutely valid question. So when we do the procedure, the eyelids are separated by a wire speculum, and patient is asked to look at one target. And if the patient's eye moves, the machine has got a tracker system wherein it follows the movement of the eyeball, and laser is delivered accordingly. If the movements are very gross, then the surgeon is seeing through the microscope, and he has all the power to stop the procedure in middle and ask the patient to reconcentrate and restart the procedure. Let's see the next question. So when can I resume my work after LASIK? Well, majority of the patients are fit to start their work or their studies from third day onwards. Only thing to remember is they should not overstrain their eyes in front of the screen, because LASIK tends to cause a little bit of dryness, and screen time also leads to dry eye. So one has to remember that. Along with that, the schedule of the medications have to be followed. So working is absolutely no problem. They can start reading, writing, doing their office activity also. Let's move on to the next question. So the next question says, will my power come back? I understand this is a very common worry, doubt in patients' mind. So having the power back after a few years is a phenomena called as regression. It is seen in LASIK patients, but in a very small percentage of patients. In whom it will happen, it's again a very difficult thing to predict. But what we know is that the level of power that comes is never as high as the pre-treatment power. And this power can also be treated with the help of LASIK, provided the patient has adequate corneal thickness. So, so let's move on to the next question. So, what are the common side effects of LASIK? Now, LASIK is a very safe procedure, as we discussed. More than 95% of patients will have zero power after the LASIK procedure. But in a small percentage of patients, you can still have a very minimal power or minimal residual power, which would mean that patient doesn't have to wear glasses all the time. But for certain activities, patient may still need glasses. For example, sitting in a hall and attending a PowerPoint presentation with figures in it, or driving long distances. Now, LASIK also induces dry eye, which leads to symptoms of burning sensation, irritation, and fluctuating vision. This may go up to 6 months, and then it settles down. So, and in a very small percentage of patients, they can see halos at night around the source of light. These are called as night vision symptoms, and they usually, over a period of time, also settle down. Now let's go to the query number 10. Can I wear contact lenses after LASIK? Yes. So once LASIK is over, there are some patients who still wish to wear lenses, especially cosmetic lenses. So they are absolutely allowed to wear lenses. Usually that can be done about 3 months following the LASIK procedure. So that in short were the 10 most commonly asked questions before the LASIK procedure. I hope this video has given you some important basic information that will be helping you to decide about your LASIK procedure. Thank you so much.